And our Healthy Friday conversation this morning is going to be led by Dr. Rose Jalango, who is a vaccinology and public health specialist.
Yeah.
Good morning, Dr.
Good morning.
Is a course called vaccinology?
Yes, there's a sub-specialty called vaccinology.
Okay, we're going to get into some of that, of course.
The specialist is called vaccinologist.
Yes, the specialist is called vaccinologist. The course vaccinology.
It's good to know.
It is really good to know. Yeah, as journalism journalists. Okay. Anyway, also, I have stumbled over this term for weeks, and then to imagine that the person would be sitting in front of us is great. Dr. Diana Marangu, do I say Bore? Bore. I said Bore in the morning, and I said maybe I said it wrong, but we stand to be corrected. Consultant pediatrician and pulmonologist, and a senior lecturer at the University of Nairobi. Good morning in the flesh, pulmonologist.
Good morning, Undu. Good morning, Dennis.
Good morning.
Karibu sana. Thank you both, Dr. for being here with us this morning. We're going to be looking to uncovering hidden causes of childhood pneumonia in Kenya. Big one this morning, but we'll get into all of that in just a minute. Mm-hmm. You're both in the hot seats of the Situation Room for our Healthy Friday conversation. Dennis goes to around the African continent every week, comes back from a different African country with their proverbs. He'll tell you where we are this week, and like I say, you get the distinct pleasure of then interpreting the proverb for us.
Yes. We're in Ghana, home of Kente. You think Kente, think Rurashio. Okay. We are also in land full of cocoa. There's a lady who's actually processing that into chocolate, because for a very long time we've been having chocolate from Switzerland, but now Ghanaians are doing something about it. So buy Ghana, build Ghana.
Oh, okay.
Right? Yeah, but let's go to the proverb. The proverb says, the path does not close to the person who returns. The path does not close to the person who returns. Dr. Jalang, how would you interpret it?
The path does not close
to the person who returns.
To the person who returns.
Yes.
The path does not close to the person who returns.
Yes.
How do I say that? So if there's I imagine myself walking and the path opens and takes me somewhere. So if I want to use the same route again, I can still use the same path. Mm-hmm. So I can speak to that through experience, that if I've done something once, I can do it again.
God, I love these doctors, man. Okay.
Dr. Diana.
Wow, I like that take. For me, I'm thinking about curiosity. Mm-hmm. One must be curious to first even venture in the first place in the path.
Okay.
And they'll be maybe because of what they learned by following that path, they'll come back again. I don't know. That's my take.
Your interpretation is always right because it is yours. Asanteni sana for the interpretation.
Yeah, indeed.
My high school principal would say, keep on being curious.
Oh, right. Okay.
Keep being curious. You never know.
You never know. Okay, so let's start at the very beginning of this. Before we even start to look at the causes of it, we'll start with you, Dr. Jalango. We're looking at pneumonia. What is this disease? What is it all about?
My role in pneumonia is to ensure that all households receive vaccines to protect them. Mm-hmm. So my role when it comes to this conversation of pneumonia is to speak about vaccination because we do have prevention against pneumonia.
Okay.
And we offer vaccination to children who are under the age of 5 because pneumonia is one of those diseases that affect children under 5. One of the top killers of children under the age of 5.
Okay.
So my role working in the Ministry of Health, leading the immunization program, is to ensure that we have access to these vaccines across the 47 counties and also working with the facilities to be able to deliver them to the children who should get them.
Okay. When you talk about affecting children under 5, what does this mean? They die from this disease regular?
Yes.
Okay.
So what this means is that it's one of the top 5 causes of deaths among children. So we do have malaria, we have pneumonia, we have diarrhea, we have malnutrition. So these are some of the diseases that cause children to die, especially when they're young. And when a child gets pneumonia, so it can either be bacterial pneumonia, viral pneumonia, fungal pneumonia, but today we are talking about bacterial pneumonia. It means that they are either going to be hospitalized, they can be given oxygen if it's very severe, and some of them may actually die. But on the flip side, we do have preventive tools. We have vaccines that they can be given as young as 6 weeks, 3 doses, 6, 10, and 14 weeks to prevent them from severe forms of pneumonia.
Okay. So, interesting that the different kinds of pneumonia, viral, bacterial, fungal, and all of this. Of course, we're looking at bacterial pneumonia today. So what is the cause of this pneumonia and why would it affect children more than it does adults?
So the different bacteria, I don't know if you want me to name them. For example, like Streptococcus pneumonia, Staphylococcus pneumonia, Moraxella, they are different, Haemophilus. And I like the way Dr. Rose pointed, these have actually vaccinations that are helpful in prevention. So your question was around what
causes it? Yeah.
So these are the bacteria, these are the etiologies, the pathogens that are causing this. Yes.
Okay.
They can be treated, of course, as we have mentioned, with antibiotics, which we are able to diagnose and treat and manage the patients.
Okay, so where does it come from, especially this bacteria one that we are talking about? Do you touch something? And because a lot of us believe that if you sit in the cold and or somebody has been sneezing on you, then you catch pneumonia.
No, it's in the air. You inhale it.
Okay. So it can be cold or hot and you'll get this thing.
Yes.
You know what you've done, that you've saved generations today, because we all imagine that you sit in the cold and you can get pneumonia. And people say, umekaa kwa baridi sana, sasa
utapata pneumonia. Ebu vaa jacket.
Thank you. It wouldn't make a difference if you wore a jacket or not.
I think in those cold areas, or when it's very cold, that's the time some of this, you'll probably be in crowded rooms. You're experiencing these pathogens, many of them together. The windows are closed. You don't have very good ventilation, so you're exchanging all of this different
Open
pathogens.
a window. You could save a life. Open a window.
Important.
So good ventilation.
Dr. Rose, we talk about vaccination in the country, which is, many would say, is what should happen in terms of dealing with diseases that can be avoided. But then we live in a country or in a society where our health-seeking behaviors is kidogo wanting. When it comes to children, we have beliefs that a child is a child of God. God will take care of them, so we need not go to hospital. What does that mean in the overall well-being of children, especially in those societies or those communities where they do not believe in seeking medical assistance? Vaccine is not in their space.
Thank you, Dennis, and I do hear you. So one of the reasons we want to protect children before they grow is that, remember, they are born young, their immunity is still very young, not used to the germs that we've all encountered. So we need to protect them before and make them stronger before they start fighting diseases. And I know most of the children that we target are the children under the age of 1 year. And we depend on their parents to be able to take them to the facility. A 1-year-old cannot, or 6 weeks old cannot take themselves to the facility. We provide vaccines free of charge to ensure that every child gets it as a public good. But again, I want to acknowledge that the access to vaccination is not 100%. So where we stand as a country is out of 10 children, 8 are vaccinated fully. But we go to some areas where not all of them. So, for example, 7 out of 10 children that you encounter are not vaccinated. Some of the reasons why children or mothers don't take their children for vaccination are varied. So one, it can be because of an access issue. Access means that the health facility is very far. So I'm speaking on behalf of that mother who lives in Garissa, where the health facility is 10 kilometers away. So they have to juggle. Do I do my housework? Do I take care of my house? Or do I go to the facility?
And this is a reality. We're not just pulling numbers out of the...
No, this is a reality.
Okay.
So for such a mother, what we do is that the healthcare worker does what we call outreaches, bringing services closer to them. And by this, I mean they can set up a vaccination center in a market or in a mosque so that children can be able to be vaccinated in that particular context. Back here in Nairobi, I'm a mother working in Nairobi, and I'm supposed to be at work at 8 and I'm supposed to come back at home at 5. Vaccination centers open 8 to 5. So even if I want to go to get my child vaccinated, I'm not able to. So what does it mean? It means that we work with the county to be able to provide flexi hours for working mothers like me, for me to be able to get vaccinated. And I know faith plays a big role when it comes to vaccines. And that's why we have to partner with the churches, with the religious leaders, that every time we have an intervention, even as the religious leaders talk to them about their spiritual well-being, they need to talk alongside health, because some of our beliefs, as you are rightly saying, I can say that my child is going to be protected by God, so I don't need to be vaccinated. The analogy I want to draw here is, for example, the way when we travel in cars, we have to put seatbelts to protect us from accidents. Are we going to get... So we are not sure whether we are going to get an accident, but in case of an accident, the severity is going to do what? It's going to be minimum. So that's how vaccines work. So God is there to protect all of us, but we need to act in wisdom, especially during the healthcare seeking behaviors. And we work with these religious leaders to be able to train or to teach their congregation that health is also part of their spiritual practice.
Dr. Diana, here is where then, as a consultant pediatrician, in terms of numbers that we see over time, right, are we seeing more parents jump on vaccinating their children? Because the easiest way to protect your child is by getting the vaccine, so that in the event that they get pneumonia, it is not severe. Are we seeing more parents jump on that? Are we seeing numbers improve over time? And with that, then the severity of the disease going down?
So I might not have the exact numbers, and I know Dr. Rose might have that, but from clinical practice and also seeing the patients on, like on the ward, most of these patients have actually had their vaccines done, and parents are eager to vaccinate their children.
What are symptoms of, let's just stay with this bacterial pneumonia here. What are the symptoms that you would then say, okay, something is wrong here and it's beyond your, common flu or passing headache and fever?
So these children will present, for example, with coughing. Then that might be the more common one. Then difficulty in breathing. When you see a child starting to breathe much faster than the usual, they have a fever. So those are the entry points into which you start suspecting pneumonia, and you need to take your child to the hospital. We don't want to get to the point where it's too severe with the danger signs. Now they're unable to feed. They're unconscious. That's very late. So as early as possible, we encourage the parents to bring their children in when they are having those symptoms: cough, difficulty in breathing, fast breathing, fevers. Yes.
And so what tests are being done? Because this is beyond just, sticking a thermometer and saying that your fever is at 40. What are we doing here that would then show that this is beyond a common cold or passing fever?
So we do have the basic pediatric protocols, and most of pneumonia is actually managed empirically. So that child who will come in with a cough, difficulty in breathing, fever, fast breathing, we're able to classify them.
Okay.
Is this severe pneumonia or not? And there's then algorithm or a way that we look, and we're able to say this child needs antibiotics, this child needs to be hospitalized. Yes. So and that's the first step. Then when it comes to now additional tests, there are those children who will need that chest radiograph, the X-ray, what we call the chest X-ray. Some may need testing to look at, is this viral, is this bacterial, with swabs. Depending on which setting you're in, you can be able to do those PCR tests again, but it doesn't mean everybody has to have that. Especially for the bacterial pneumonia, once they have those clinical symptoms, then we know this is a pathway, and we will start antibiotics and treat them. For those who are not improving, then there's other approaches that we take to do more investigations.
So with the application of antibiotics, then how long does it take for, the healing to kick in?
So most children will respond to a 5 to 7 day course of antibiotics. Again, once you make a diagnosis, you're managing the patient in front of you, that child who's in front of you. So it will depend on their response. Are they responding to the treatment? Is their fever coming down?
Yeah.
Is their difficulty in breathing improving? Do they need the oxygen or not?
Yeah.
Are they getting better?
Okay.
So that is what gives us the clues to what now the next steps are, whether we are going to continue the same antibiotic, whether we're going to change the different antibiotics.
Oh, okay.
Yes.
So can they be on treatment and go home, or must they be admitted in hospital? Dr. Jalango talked about, sometimes you're going to have to admit. Do you have to admit a pneumonia patient?
Not all children with pneumonia have to be admitted.
Okay.
If they have the danger signs, then they are hospitalized.
Okay.
Yes.
Why would, Dr. Jalango, a patient not respond to an antibiotic for pneumonia positively?
So I think why a child would not respond to antibiotic positively is one of the work that Dr. Diana has done in terms of underlying causes of child genetic causes that she's going to tell us more about. Why there are some children who get recurrent pneumonia, they don't get well, and these are the children who get to be vaccinated, who need to be vaccinated more. So Dr. Diana, you can shed into the type of work that you've done on that.
Okay, sure. I'm happy to talk about that. But also maybe to add on what you said, there are children who may not respond because for example, if they had a complicated pneumonia, they have fluid in their lungs that needs to be removed. There are so many other different things that could be even in an infectious setting where they'll need other things to be done, and they're not responding so well. But as you spoke so well, Rose, and introducing the work that I'm doing, I'm an African postdoctoral training initiative fellow, and one of the things that I'm doing in my research, I'm looking at these children whose immunity is compromised for other reasons, and those could be genetic causes. So these are some conditions like, for example, cystic fibrosis, for primary ciliary dyskinesia, and I'll talk about that more, and inborn errors of immunity. So their immunity is not working as it should to fight this bacteria, for example, that's in the primary immunodeficiencies. Or when I said primary ciliary dyskinesia, or what we'll say in short PCD, we all have little hairs in our airways. They're microscopic, we may not be able to see, and they help in the clearance of this bacteria and the mucus. So they may have this as an underlying problem. Also, in cystic fibrosis, it's also a genetic condition. Again, these are some of the conditions where these children may be prone to having repeated pneumonias, recurrent pneumonias, persistent pneumonias. But the problem is underlying is from a genetic problem. Yeah.
Doctor, you see, when you talk about pneumonia, there is where now we go to Daktari, we take tests and everything, X-ray and all that. But then again, there have been conversation, and you can confirm whether it's right or wrong, that other factors as well could be contributing to the same, where we talk about air pollution, we talk about a poor living condition, malnutrition as well being factored in there. And we talk about public health, right? Everything else have to be looked into for us to say, even while we're issuing vaccines, everything else has been taken care of. So then how do we have this conversation so that it's not just as a parent, I will go and get vaccinated, but I've not handled the most basic things at home that will ensure my child is not exposed to these factors as well.
Excellent train of thought, Dennis. So when you're looking at a child, we look at the child holistically.
Okay.
And what we do to the healthcare workers and as low as the community health promoters is that they're empowered with information to be able to have a checklist of, when you go to a household, this is what you ask the mother about the child. Is the child feeding? Is the child having the right weight? Is the child having the symptoms? So that we can be able to refer this child on time to the health facility. But again, the community health promoter, because they interact at the household level, they are able to look at, do you open your windows? Are you ensuring that you live in a well-ventilated room? Because all these things contribute to disease. Then at the health facility, when they go there, the caregivers are actually taught, apart from the child getting vaccinated, these are the other measures you need to take. They need to eat well, they need to be clothed, they need to be warm, they need to have additional supplements. This is what you need to use at home when you're cooking. So there is some holistic health education. So vaccines do not work in standalone. They work with other complementary interventions for the well-being of the child.
Would you reckon, are there seasons when, say, from research or from just numbers that you get, are there seasons where you see the numbers go up? And which seasons would that be?
So vaccines are supposed to be given all year round. So every day a child is born, every day a child turns 6 weeks old. And then I rely on Diana to give me feedback on, do you see an increased admission in July when it's cold? Do you see an increased admission when October during the short rains? And I rely also on the research institutions, because every time we introduce a vaccine, we also do surveillance to check whether the numbers of disease burden is going down. So for instance, when we introduced pneumonia vaccine 15 years ago, we've seen that the numbers of hospitalizations as a result of pneumonia has gone down. The number of cases of meningitis, the number of cases of severe ill health in children has significantly gone down. So the children who keep coming to the clinic are the ones Dr. Diana is talking about, the ones who have a malfunction or whose immunity is not working properly. And that's why we recommend that all children should go get vaccinated on time and complete all their schedule for complete protection.
Dr. Diana, which season would you say you see a spike in numbers?
No, as Dr. Rose rightly said, in the cold seasons, there's actually the work you've talked about from surveillance from KEMRI, which gives ideas of the seasonalities. And sometimes it has changed over time, but the cold, rainy seasons, we see, especially the influenza, the RSV, these are viral causes of pneumonia that tend to peak during those times, that we've seen the evidence from the surveillance. Yes.
Okay. Dr. Jalanga, we have habits whereby going in to get a proper diagnosis is difficult for some of the factors that Dr. Bora has mentioned. But then what that also does is that we self-diagnose because of our sometimes corrupted health-seeking behavior. And then we go and then we self-prescribe. And we go to a chemist or pharmacy or whatever, and we say, give me this for my child, for myself, whatever the case may be. This is not foreign. It's a very common practice. And many have said that this practice, even when there is a present disease, has led to antimicrobial resistance. And if we are looking at that as concerns pneumonia, could it be one of the issues whereby children are constantly brought back with the same or a different strain of this pneumonia?
So what I'd want to speak about is how vaccination prevents antimicrobial resistance. And whenever a child is vaccinated, it means that they do not have episodes of pneumonia or they're unlikely to fall ill.
Okay.
But if you don't vaccinate a child and you self-diagnose and go get antibiotics over the counter, what you are encouraging is that not the correct use of antibiotics, and that is how we get antimicrobial resistance, because first, we don't know whether the child needs to get that antibiotic, and secondly, we are using the antibiotic incorrectly. So this child is more likely to get antimicrobial resistance, such that whenever they're unwell, they can only respond to antibiotics that are higher than what would normally respond to them.
Okay.
So immunization is one of the strategies to combat antimicrobial resistance.
Okay. What do you do in the event that a child is not responding to the treatment that you have prescribed?
Yeah. Thank you, Ndu. So it depends again with the child, and we look for what is the possible reason. So it may be that if it's a bacterial pneumonia, it's complicated, and we need to manage those complications, and we need to step up the antibiotics. We may need to test further. So further imaging, either to look with a chest X-ray, to look with even much more imaging like a CT scan, to look for what is the bacterial cause or viral or other cause, either looking at the sputum or the other samples that we can collect, and then managing that appropriately. We also have to look at that child themselves. You talked about very interestingly and very importantly their nutrition. So these children can come with comorbidities. They are malnourished. We must address that. Maybe there's a problem. They're swallowing badly. The food is going into the lungs. That other additional problem has to be identified and managed. So we must manage these other issues that are happening for the child to get to the bottom of what is happening. So treating the infection, as we'll call it as pneumonia, and then managing these other conditions that the child could have come in, which make them more prone or more at risk to this. Yes.
You see, Doc, one thing that is out here, aside from self-medicating, is fact that my mother also told me I was like that, so probably the child is going to be okay, you know. As well as perhaps as well we need to drink some chai dawa here and there, and I'm going to be okay. That leads to delayed treatment. By the time someone is ending up now bringing the child, time that was critical to treat this child has passed. When that happens, how difficult is it then for you to treat this child because it is late into the treatment phase?
Yeah. So you've hit the nail on the head in terms of early treatment. Early identification is very important, and that's what we started with, knowing those symptoms. And it's as you said, with the community health workers and promoters, that's the information. The mom, the dad, they need to be able to know this is the time to bring this child as early as possible. Of course, when they come to the hospital, then at that point we'll have to manage as is needed. So maybe the point, I don't know, Dennis, that you're saying, and maybe we need to emphasize these symptoms: cough, difficulty in breathing, fever, fast breathing. This is what we want our audience to understand early on. These are the signs that they need to identify early and bring their children early to hospital if they have already symptoms.
How expensive is treatment for pneumonia? Because talk about 5 to 7 days, you should be able to be wrapped up in that. But how expensive is that? Because again, we can't run away from that being a factor for a lot of people to go seek health care.
Cost. Okay, this might not be my area of expertise about cost, but you can think of it. I'm a parent as well. So yes, there's cost of your treatment directly, the antibiotics, but there's also the cost of the mother or the father being away from work. There's the cost to the health system as well. So this is a really costly affair. But maybe Dr. Jalango, do you have maybe exact numbers?
Yeah, so this is where I say, Ndu and Dennis, you're our partners, and you reach the audiences every day. And in terms of health seeking behavior and also creating awareness across different platforms, that when you're unwell, it's good to seek hospital advice
Yes.
or intervention, because the more you delay, the more expensive it gets in terms of diagnostics and also treatment, and also the cost to the general health system. So understand the point of our health-seeking behaviors are very different, and we tend to use a lot of social media, ChatGPT, AI, ask the symptoms, go to the pharmacy, get the medication.
Yes.
But that has its own consequences. So we'd advise that they go to the nearest facility to be able to be sorted out.
Yeah. Because most of the time, my chest is congested, inaweza kuwa ni pneumonia, and at some point I saw someone taking medicine A, B, C, D. So perhaps there's a point where for anyone to know what exactly they're treating, then there is need for professional advice, the test that you talk about, for them to be able to prescribe the necessary treatment. Because you can correct me, is it true that pneumonia can only be treated through antibiotics, or are there other means depending on what it is you've seen?
Yeah, so thank you, Dennis. So you're talking about treatment. Yes. And that's why going to the doctor, the health worker, the professional, because they'll help to identify, is this infectious? Is this something I'll treat with a bacterial, with an antibiotic, because this is probably a bacterial cause, or is it something else in addition to that? So seeking that health care professional expertise is very important early on. As early as we identify there's a problem, seek help. Yes.
How do we differentiate, for those who are home, pneumonia from just common cold?
So in the common cold, it would just be cough and runny nose. That's what we call a common cold or an upper respiratory tract infection. But then we've talked about that child who's having difficulty in breathing, fast breathing. They may not be able to feed. These are the danger signs now we are talking about. They're not responding. They're gotten unconscious. That one, for sure, most people bring the child to hospital. But the child who is repeatedly, maybe even having repeated episodes, that's one. Or they're having that inability to feed. They're having the fevers, the fast breathing. And parents actually know. They know there's something wrong with my child. And so they seek care. They need to seek care. Do you want to add something?
As Dennis was talking, I was wondering, there were times I just say I have similar symptoms to you, but underneath I might be having hypertension, I might be having HIV, I might be having diabetes, and then we start comparing our treatment, which is not very fair. So that's why when someone goes, they are looked to the health facility. It's the healthcare worker is able to look at them holistically.
So pneumonia is aerosolized, right? And so, is it contagious?
Can you get infected from another person?
Yeah.
So it's in the air. So if you're holding certain, like you've coughed. Remember COVID times, and we did all those things.
Yeah, in fact, the minute we heard that COVID was aerosolized, we were all saying, "Sit over there, don't even try sneezing near me." Yeah.
So
cough into your elbow, kind of thing.
Things. If it's on your hands and you touch, of course, there's that transmission.
So I could get pneumonia if somebody sneezed on the table and was infected, and I came and touched that table. I could get pneumonia.
And you touched then your mucosa, of course. But remember, all those things that we were really talking about, COVID is also pneumonia.
It is,
I mean, the SARS-CoV-2 is a virus that can result in pneumonia.
Okay.
So those principles we had very well. It's important to also apply them to other viral pneumonias or other.
Okay, so maybe we can play around a little bit, because if we're looking at bacterial pneumonia affecting children, how far is viral pneumonia affecting children? Is there one over the other? Do you find more bacterial pneumonia in children than you do viral pneumonia?
So they're all there. They're all at play.
Okay.
And it doesn't mean because you have a bacterial pneumonia, you can't have a viral pneumonia. You can have multiple pathogens. They're in the air.
Oh, ew.
So it's possible to have a bacterial pneumonia together with a viral pneumonia. It doesn't say this is RSV, it's refusing, and this is strep pneumonia. They're different pathogens, and they can't happen in the same patient. So that can happen. Increasingly, though, we are beginning to see more viral causes of pneumonia. Identifying, again, you need the diagnostics. Just the same way we were using PCR for SARS-CoV-2 for COVID.
What are you testing? What are you using to test for viral pneumonia?
It's the same PCR test.
Okay.
Yeah, so you're able to say RSV, respiratory syncytial virus, that's its full name, influenza, and there are very many other viral pneumonias, adenovirus. Yeah, so those can be tested. But for us, we go with a simplistic, or maybe I'll say it's a simplistic approach that is going to cater for most people. Yes.
Okay.
Dr. There is a behavior that many have out here. Maybe we're all guilty of it. We see a small child, a baby, and everybody wants to go to that baby. You know, somebody has a cold, but because the baby is so beautiful and you want to be part of carrying that baby, they choose to be quiet about it. Or others are just sneezing all over the place next to the baby. You know, so here now is another holistic approach in terms of the baby's immune system has not developed yet to be able to deal with this. Therefore, it behooves upon us all not only to take care of that baby by taking care of ourselves, because then we would be putting that baby at risk.
You've summarized it quite well, Dennis, that the baby is young, does not have a mature immune system. So even as we handle the babies as aunties and uncles, we really need to be wary of and be considerate to the baby and the mother that we can pass infections. But remember, again, childhood vaccines start at birth, 6 weeks, 10 weeks, 14 weeks. And during that time, we also encourage the mother to fully ensure that the baby breastfeeds, so that at least some of the antibodies from the mother are passed to the baby to be able to fight any sort of infection and take good care of the baby to protect the baby holistically.
And how good is exclusive breastfeeding during the time help in as well addressing the same?
It's critical, it's crucial. And you talked about nutrition. I really like that we're talking to our audience about nutrition. So exclusive breastfeeding for the first 6 months, and then appropriate how we do our complementary feeding together with exclusive breastfeeding is very crucial in terms of protecting children when it comes to pneumonia. Yes.
Some of the associate behaviors in addition to vaccination and some of the things that you spoke about. I mean, and again, yes, we're talking to an audience, but we're human beings, it's people. I mean, there's the science of it and everything that's in the books, but what I would assume helps medical practitioners is the daily behavior for you to then be able to know. And one of the things we do, Dr. is that we wrap up these babies within an inch of their lives. And I get it that you're afraid of the cold weather, but I'm hearing you say also that could actually be a detriment than actually an aid. And like, again, keeping the windows open, never open it to a crack. Everybody's breathing in this air and the baby's wrapped up, and then we go to and then we find doctors and nurses removing layers and layers of clothing and saying this child must breathe. What is an adequate cover for warmth for this child as opposed to dressing them up like an Eskimo?
What I'd say do is that different babies have different needs, because I know there's someone who's listening in and their baby is 1.8 kilos. There's someone else whose baby is 5 kilos. And again, their needs are very different.
Sure.
So what I'd encourage the audience is that as much as possible, speak to your healthcare provider so that they can be able to guide you. This is how to take care of your baby. Every person is unique. Every baby is unique.
So there will be some who need the multiple layers of clothing, and there will be those who you want to say, okay, let go of some of that.
Yes, a child who lives in Kiambu vis-a-vis a child living in Kisumu, their wrapping up is going to be quite different.
Right.
Yes.
Okay.
So they need to talk to their healthcare providers to ask the questions, and they're going to be guided appropriately.
Okay. There's some questions coming in, and may not be pneumonia, maybe, but while you're here, okay. So one of us talks about the fact that a child has had a dry cough for about 5 weeks, are on antibiotics and antihistamines until yesterday, when they were told that he may be suffering from stress at the hospital. Is that a thing?
So I'm just reiterating what Dr. Rose has been talking about and what most of our conversation has been. They need to seek professional healthcare advice. They need to go see their doctor because they sound like they have symptoms. These need to be addressed by a healthcare professional who will see them as a whole person. Yeah, so they may have other issues that need to be addressed, but if they indeed have an infection or they have pneumonia, they need to be managed appropriately. Yes, that would be my comment for that guest.
And is a dry cough a symptom? Or would it be a progressive or any cough, progressive,
yes,
dry,
cough,
anything? Okay.
As long as they're coughing, they're having difficulty in breathing, let them seek medical advice.
What challenges do you face or medical facilities face when dealing with severe pneumonia?
In terms of
any challenge
from a health system, it depends on where you are.
Yeah.
Remember, are you in the public system or in the private system? So the challenges might be quite different. Yeah. Again, treatments, the antibiotics, are they available? That could be some of the challenges. Do you have oxygen? Do you have more advanced support? Because some of these children may need ventilation, may need ICU care. So it depends on the setting. Yeah, it depends on the setting. Where are we? Kenya is a very, how would I say, there are different contexts and different health facilities. So I might not be able to speak to all the different facilities, but those are some of the challenges that could be there, and health workers as well. Yes.
So there was this raging debate, Dr. Jalango, about vaccination and for whom it was manufactured or designed. So is it the case that a lot of vaccines that we have used as people of African descent, this now is talking about our makeup, that the vaccinations we use may not have been created for people of African descent? Now, when we look at pneumonia, are we looking at vaccines that were manufactured, created here so that it understands our makeup and says that you will react to this in this manner, you would react to this in the other way? And especially for the conversation that we're having now about pneumonia, are we looking at vaccines that have been made for the African baby?
That's an excellent question, Du. And I know there's been a lot of changes in the vaccine space. I know previously what was happening is that African countries used to introduce vaccines that are available in the market. They are told this is the vaccines that need to be introduced to prevent children from pneumonia, meningitis, and all the other diseases. Over the last 20 years, we've seen African countries participating actively in research. You'll find that most of the trials before vaccines are manufactured are actually done in African setting. So, for example, malaria vaccine, HPV, pneumonia, they've all been conducted by our research institutions during the clinical trials before rollout. And before any decision is made in the country to introduce a particular vaccine, we rely heavily on data from our research institutions because different countries introduce different types of vaccines based on their population. So I'd say yes, we work closely with the different research institutions to introduce vaccines that are suitable for our population. Even during COVID, a lot of trials were conducted in Kenya so that we see how do we respond to the vaccines that are actually being manufactured. So yes, we do contribute quite a lot in decision making on vaccines.
Okay. There's an update to that question that gentleman had asked previously about his son, and he said that they've actually gone in, they've done a TB test. I'm going to ask a question about relation between TB and pneumonia if there is one in just a minute, but they've done chest x-rays, they've done a full hemo, and all of these proved negative. They've done all of this, but the cough is still there.
And I still insist. They need to seek care. They need to be seen by
a specialist.
A specialist who can address this. Yeah. So and maybe to your point about and thank you for bringing this conversation about tuberculosis. It's also a bacteria, mycobacteria. Tuberculosis is a type of a bacteria that can cause pneumonia. Remember when we started?
Hang on.
Yes.
tuberculosis bacteria can cause pneumonia.
Yes.
Okay.
So you remember when Dr. Rose started, she said there are bacteria, there are viruses, there are fungi. So there are a number of different infectious organisms that can cause pneumonia. So tuberculosis is one of those, is a cause of pneumonia. Maybe to bring it there. But for the patient, for the person who is in the audience who asked that question, it's important. Let them see a specialist. Let them see a specialist.
A pulmonologist.
It could be, depending. That it's a child.
Okay.
Is it a child?
Yes.
Yes. So they can see a pediatrician, and they can also see a pulmonologist.
So,
yes.
What's the relation with? So we have pneumonia, meningitis, and at what point do they interact?
Okay. So remember the bacteria that causes all these infections. So when the bacteria goes to the body, affects the lung, we call it pneumonia. So the bacteria can spread in the system, goes to the brain, causes meningitis.
Okay.
It can spread, goes to the ear, causes ear infection. Yes. So when you're vaccinated, it's the same organism, but so that when you're vaccinated, you're protected from pneumonia, meningitis, ear infections, and severe blood infections. And for the point on TB, that's why we give BCG. The very first one, when the baby is born, to protect our babies against the severe forms of TB.
Okay.
So that's why they need to be vaccinated against. They need to have the BCG vaccine.
I mean, because as I just hear us talk about it, then we can't emphasize the need of having community health promoters then, because these are individuals who are with Kenyans pretty much on a daily basis, and they would be able to tell such a house has a newborn. Can you go check whether they have BCG, whether they've gone through ABCD? Because then that would prevent that baby from coming for treatment, because already we've handled the basis. They're equally able to look at the air quality in that house, how they're living, nutrition and all those. So how critical then is it now for you in insisting or working together with community health promoters in ensuring that everything is handled?
Yeah, and Dennis, thank you for that. Actually, you can see even being here, being present, this is also part of the work in terms of early diagnosis, prevention in the first place. So you have to work together. It has to be from health workers, health systems, and the community health promoters are part of the health system. They are. The doctors are also part of the health system. Even us as community, the way we are talking right now, we are passing a message to the audience. They're listening. So this is not one person's game. We all have to work together. I like the word you used, partner and collaborate in ending pneumonia. So it's from prevention. It's also from early diagnosis, and protection strategies that we just discussed. Yes.
Okay, that's interesting. So it's possible to end it. Is it possible to end it? Kind of like how COVID just kind of disappeared, and then we didn't see it, anymore. Every now and then you say you have a kind of that particular strain of COVID, for example, because you said pneumonia is a COVID-ish kind of thing, but
no, did I say pneumonia is a COVID?
Well, I mean, you said it's.
I said that SARS-CoV-2 is a virus that causes pneumonia. Like many other viruses that could also cause.
So, is it possible then that you will be in a place where then it disappears? Can you get, because you talked about preventing and ending pneumonia? Is it possible to end it?
Prevention, protection, and treatment. So these are the pillars. They're actually it's part of the global action plan for the prevention and treatment of pneumonia and diseases and diarrhea, GAP-D. It's actually a strategy used by the World Health Organization when it comes to managing severe pneumonia. Sorry, I wasn't using my microphone. Thank you. So prevention strategies, the vaccination that we've talked about, protection. We've talked about nutrition and the others as we have discussed. And then treatment, seeking treatment early. These are the cornerstones when we are talking about pneumonia.
All right.
There is a question around mold in our houses and how those would predispose children to complications, perhaps. I don't know. I've just been sent that does mold in our houses expose not only an adult but a child as well to the same?
I think mold speaks to ventilation of the house. If it's not well ventilated, you'll find mold growing in some spaces. So we need to live in well aerated rooms and also homes. And also to add on to what Diana has said, when it comes to pneumonia, we want to reduce the impact or reduce deaths associated with pneumonia.
Okay.
So maybe not ending it, because remember, vaccines alone do not work in isolation. They need to work with the environment, they need to work with nutrition, they need to work with all other elements to be able to protect the child holistically. So let's say we are reducing the deaths associated with pneumonia.
Yes. Absolutely. Our Healthy Friday conversation today has been around pneumonia in children, uncovering hidden causes of this. And hopefully we've run away with something today, because then you can prevent it, you can treat it, you can prevent it, you can diagnose it, you can treat it, and help everybody just be a little bit healthier every day. Dr. Rose Jalango is a vaccinology and public health specialist. Dr. Diana Marangu Bore is a consultant pediatrician and pulmonologist and senior lecturer at the University of Nairobi. Thank you, both of you, for being here this morning. Asante Sana for joining our Healthy Friday conversation.
This is the Situation Room, the only way to start your day.